Hi, my name is Sherry, and today I will be discussing ethical and policy factors in care coordination. Care coordination is a central part of nursing practice because it ensures patients receive safe, organized, and patient-centered care. Ethical standards, especially the ANA Code of Ethics, guide nurses in making decisions that support patient well-being, respect autonomy, and maintain professional integrity. Ethical practice environments also help nurses communicate effectively, collaborate with colleagues, and uphold responsibilities that support coordinated care. Policy plays a major role as well. The Affordable Care Act includes care delivery provisions that expand access, strengthen safety, and encourage more integrated approaches to care, all of which directly affect how nurses coordinate services for patients. Ethical concerns also arise. When public perceptions of nursing are influenced by professional behavior, such as social media conduct, which can impact trust and expectations within coordinated care settings. Together, ethical standards and policy provisions shape how nurses support patients across the continuum of care and ensure coordination remains safe, equitable, and aligned with professional values. The ANA Code of Ethics provides the foundation for ethical nursing practice and directly influences how nurses coordinate care. It outlines core values such as respect for autonomy, advocacy, fairness, and professional integrity, all of which guide nurses when making decisions that affect patient care. Nurses rely on the code to navigate complex situations, uphold ethical standards, and ensure that coordination of care remains patient-centered and equitable. Ethical practice environments reinforce these standards by promoting communication, accountability, and professional behavior among the healthcare team. Public trust is also shaped by how nurses uphold ethical expectations, including maintaining professionalism in public space and online platforms, which can influence perception of nursing and coordinated care. Together, the code and ethical practice expectations help nurses deliver coordinated care that is safe, respectful, and aligned with professional values. Ethical practice environments are essential for effective care coordination because they create conditions where nurses can uphold professional values, communicate openly, and advocate for patient needs. Stokes emphasizes that organizations have a responsibility to maintain ethical climates that support fairness, respect, and accountability. These environments help nurses navigate complex decisions and reduce ethical conflicts that can arise when coordinating care across multiple providers or settings. Ethical environments also influence public trust and expectations. Professional behavior, both inside and outside the workplace, affects how patients and communities view nursing as a profession. When nurses work in settings that reinforce ethical standards and support the ANA Code, coordination of care becomes more consistent, transparent, and aligned with patient-centered values. Ethical dilemmas often occur in care coordination when patient needs, organizational policies, available resources do not align. Nurses may face situations where respecting patient autonomy conflicts with safety concerns or where fairness in resource allocation becomes difficult. The ANA Code of Ethics help guide nurses through these dilemmas by reinforcing core values such as respect, advocacy, equitable treatment. Ethical practice environments also play a critical role by supporting transparency, communication, and shared decision-making when dilemma arise. Professional behavior adds another layer to ethical decision-making. Public trust in nursing can be influenced by how nurses conduct themselves both in clinical settings and public spaces, including social media. When trust is compromised, ethical expectations become more complex, and coordination of care may be affected. Using the ANA Code and organization ethical standard helps nurses navigate these challenges and maintain integrity while coordinating care across the continuum. The Affordable Care Act includes care delivery provisions that directly influence how nurses coordinate care. Terry explains that the ACA expands access to essential services, promotes preventative care, and encourages integrated team-based approaches. These provisions reduce gaps in coverage and help ensure patients receive consistent support across the continuum of care. By improving access and continuity, the ACA strengthens the structural foundation needed for effective coordination. The ACA also reinforces ethical obligations within nursing practice. When access improves and barriers decrease, nurses are better able to uphold ethical principles such as fairness, advocacy, and respect for patient autonomy. Ethical practice environments further support these responsibilities by promoting transparency, communication, and accountability in coordinated care. Together, the ACA policy and ethical standards help create conditions where coordinated care is safe, more equitable, and more patient-centered. Policy provisions influence care coordination differently at the national, state, and local levels. Nationally, the ACA established broad standards for access, preventative care, and integrated delivery models that shape how care coordination is structured across the country. States may interpret or implement these provisions in varied ways, leading to differences in coverage, available services, and care delivery expectations. These variations affect how nurses coordinate care and advocate for patients within their specific practice environments. Local healthcare organizations must adjust workflow, staffing, and communication processes to meet both state and federal requirements. These differences can create ethical challenges when access, resources, or expectations vary across settings. Nurses rely on the ANA code to navigate these dilemmas and maintain fairness, advocacy, and professional integrity regardless of policy differences. Understanding how policy operates at each level helps nurses coordinate care more effectively and ethically. Policy provision, including those in the Affordable Care Act, can create ethical challenges when covering limitations or resource constraints affect patients' access to care. Although the ACA has expanded access, differences in implementation may still create barriers that require nurses to balance advocacy, fairness, and patient autonomy while coordinating care. Ethical practice environments support nurses through communication, transparency, and shared decision-making, while professional conduct strengthens public trust and promotes equitable patient-centered care. Public trust is essential to coordinated care, and nurses' professional conduct directly influences that trust. Nurses' behavior, both clinical settings and on social media, can shape public confidence in the profession, making it important to uphold the ethical standards outlined in the ANA Code of Ethics. Ethical practice environments promote accountability, transparency, and respectful communication. Strengthening trust among patients and healthcare teams, policies such as Affordable Care Act also rely on ethical nursing practice to support safe, equitable, and patient-centered coordinated care. Advocacy is core ethical responsibility in nursing that supports patient-centered coordinated care. The ANA Code of Ethics guides nurses in protecting patient rights, promoting autonomy, and ensuring fair decision-making, while ethical practice environments encourage communication, accountability, and collaboration to address barriers to care. Policies such as Affordable Care Act also influence advocacy by shaping access to health care services, making it essential for nurses to promote equitable care, maintain public trust through professional and ethical practice. This is presentations highlighted how ethical standards and policy expectations work together to shape coordinated nursing care. The ANA Code provides the foundation for ethical decision making, while supportive practice environments strengthen communication, teamwork, and accountability. Policy provision, including those in the ACA, influence access and care delivery structures that nurses navigate every day. Professional conduct and public trust reinforce these responsibilities, helping ensure that coordinated care remains safe, equitable, and aligned with core nursing values.